How do you perform a review of systems for USMLE patient encounters? Imagine you're sitting with a patient and they mention a cough, but then you ask about other symptoms and suddenly they mention fatigue, weight loss, or headaches. That's where the review of systems comes in. It's a way to find out what other issues might be hiding beneath the surface. When you perform a review of systems during a patient encounter, you ask about symptoms related to each major body system. This helps uncover signs or complaints the patient might not have mentioned initially. You want to do this after you finish the history of present illness but before the physical exam. Keep your questions simple and clear. Use language that the patient understands. Focus your questions based on what the patient has already told you. For example, if they complain of chest pain, ask about shortness of breath or palpitations. The review of systems covers 14 main areas. First is the constitutional system, asking about fever, weight changes, or fatigue. Then the eyes, inquiring about vision changes or eye pain. Next is ears, nose, mouth, and throat, asking about hearing loss, nasal congestion, or sore throat. The cardiovascular system questions focus on chest pain, irregular heartbeat, or swelling in the legs. For the respiratory system, ask about cough, difficulty breathing, or wheezing. The gastrointestinal system involves questions about nausea, vomiting, abdominal pain, or diarrhea. For the genitourinary system, ask about pain during urination, increased frequency, or blood in the urine. The musculoskeletal system questions include joint pain, stiffness, or muscle weakness. The skin or integumentary system involves rashes, itching, or skin lesions. The neurological system includes headaches, dizziness, or weakness. The psychiatric questions cover mood, anxiety, or sleep issues. Endocrine questions look at temperature intolerance, excessive thirst, or urination. Hematologic or lymphatic questions focus on easy bruising or swollen lymph nodes. Lastly, ask about allergies or immune system issues like recurrent infections. The depth of your questions depends on the situation and time. For the USMLE exams, especially the clinical skills part, a focused review on relevant symptoms is enough. But for a full assessment, a more detailed review can be helpful. During the encounter, listen carefully, ask open-ended questions first, then narrow down with specific ones. Show empathy, avoid interrupting, and confirm you understand what the patient says. When documenting, note any positive findings and relevant negatives. Be sure to include details like when symptoms started, how severe they are, and what makes them better or worse. For the USMLE Step 2 clinical skills exam, your goal is to be concise but thorough. Practice common symptom patterns and think about how these findings fit into your overall diagnosis. Remember, the review of systems is a tool to gather extra clues about the patient's health that might not be obvious at first glance. It helps you build a complete picture and plan the best management. So, approach it systematically, stay patient-centered, and keep your questions clear and focused.